The quality of prenatal care has a vast effect on birth outcomes. The best prenatal care includes one that addresses both the physical and emotional well-being of the woman. The traditional medical model of care for childbirth has the overall attitude that pregnancy and birth is an event that needs to be controlled, monitored, and managed within a certain amount of parameters, often centered on measurements, continuous monitoring, intervention, and pain medication. There is an incredible level of fear around birth in North America, which has led to the over-medicalization of birth. A new study reports that the U.S. is one of the only 8 continents where maternal deaths are rising, placing the U.S. at number 60 behind 59 countries with better maternal health outcomes. Furthermore, continual fetal monitoring leads to a higher cesarean rate and has not proven to protect the safety of birth as it assumes. The midwifery model of care provides a unique kind of care that incorporates physical, psychological, and spiritual support. Prenatal care with midwives and doulas can provide a safe haven, a subculture in which women can reclaim trust in themselves and the birthing process. Working with a midwife or doula can enhance bonding and attachment through birth and within the family dynamics, which is essential to brain development and health in mothers and babies. They can help women to prepare for birth, helping her to explore her ways that she can best work through any issues from her past or present that may impede the full use of her resources, both physically and emotionally, during the challenging work of labor, and help to prepare her for the mothering experience that lies ahead. Their job is to be a guide, to mentor her health and well-being in a holistic way, while offering expertise and experience in a way that the medical model shies away from. The applications of the midwifery model of care have been proven to reduce the incidence of birth injury, trauma, and cesarean section. One of the biggest differences between the medical model of care and the midwifery model of care is the individualization of care that the midwife can provide. To truly individualize care means to strive for a deep understanding of a particular woman, her unique physical and emotional and mental circumstances with regard to her physical well-being and living environment, as well as open-ended conversation about her hopes and fears around birth. This is midwifery's best kept secret in how to lower the risk of developing high-risk pregnancy. Hiring a doula or student midwife in preparation for a hospital birth can greatly bridge the gap between the medical and midwifery model of care. For women, conception to the first year of their child's life is a very important time. Important for her to slow down and to gather support, not only for her health, but for the precious health of her baby. How women birth and the year following lies down the genetic activation and health composition for the remainder of her baby's life. We call this time period between conception and the first year of life the primal health period, and it deeply imprints on all systems in the body, which shows up later on in life during adulthood in terms of general health and well-being. Physiological birth is the understanding of the normal processes of birth, which is very different than what is being taught in the medical model of care, which focuses mainly on all the things that can go wrong, how to manage birth in an artificial environment, and how to use medications to manage labor and delivery. A midwife or a doula can help protect the natural process of birth and offer you informed consent which is helping you to decide what level of care is best for you and your baby. Together, we can make birth an empowering experience, one that will carry you successfully into motherhood. What I offer is deep emotional support and coaching through the entire birthing processes. My services do not replace your caregiver's very important role, but rather enhances your experience through loving, continual support. A doula is a laboring companion that can help you to prepare for childbirth. There are two types of doulas. There are birthing doulas that understand the medical model of care and are willing to work with families to help them understand what all of their options are for childbirth. A postpartum doula is a doula that will help you with the baby during the first 12 weeks of life, help you to care for the baby and run the simple tasks of your household so that all you have to do is focus on being and bonding with your newborn.